Hello friends, welcome to my channel. I'm Dr. Himanshu Gupta and in this video we are going to revise orthopedics. So first I will discuss all the questions with you. You will think the answers in your mind and then I will write down the answers of each question. So let us begin our discussion. Sun ray appearance is seen in. Onion peel appearance is seen in. Patchy calcification is seen in. Judeth's view is for. Von Rezen view is for. Swimmer's view is for. Osteomyelitis, causative organism for osteomyelitis in sickle cell anemia patients. In IV drug abusers. Father deformity in hip is seen in. TB of digits is called. Of shoulder it is called. Infection of nail beds is known as. Wandering acetabulum is seen in which stage of TB hip? TB spine first neurological sign is. Fossiliferous cells are seen in. Maffucci syndrome is. MIG-22 is a specific marker for. Joints spared in osteoarthritis. Joints spared in rheumatoid arthritis. Burden notes involves PIP or DIP. Bouchard notes is seen in PIP or DIP. HLA-B27 positive disorders are. In pseudo gout, fluid analysis reveals what? Genslin's test is for which joint? Part of spine involved in RA. Pseudo fracture is also known as, and it is seen in. Champagne glass pelvis is seen in. Bone within bone appearance is seen in. Ivory vertebrae is seen in. Antibodies to rankle drug is. Ape thumb deformity it is seen in. Cock up splint is used for. Knuckle bender splint is used for. Froment sign is for testing which nerve. Erb's paralysis deformity is. Myalgia paresthetica. What it is? Chiralgia paresthetica. So friends, now I will share the answer with you. Sun ray appearance is seen in osteosarcoma. Onion peel appearance is seen in Ewing's sarcoma. Ewing's sarcoma. Patchy calcification is seen in chondrosarcoma. More than chondroblastoma. Judith view is for acetabulum. Judith view is for acetabulum. One resin view is used in DDH. Swimmer's view is for seeing cervicothoracic junction. In causative organism for osteomyelitis in sickle cell anemia is Salmonella. In IV drug abusers it is Pseudomonas. Father deformity is seen in posterior dislocation of hip and arthritis. Anterior dislocation of hip is seen in fiber deformity is seen in anterior dislocation and septic arthritis. TB of digits is known as spina ventosa. TB of shoulder is known as caries sicca. Infection of nail bed is known as paronychia. Wandering acetabulum is seen in stage 4 of TB hip. In stage 1 you see Faber deformity. In stage 2 and 3 you see Faber deformity. First neurological sign in TB spine is increased deep tendon reflexes, and first symptom is tenderness. Physalicellus cells are seen in chordoma. For more discussion on bone tumors, friends, you can see my post in my club, in my page Purpose. For more discussion on brain tumors, see my page Purpose on Facebook. Maffucci syndrome is enchondromas plus hemangiomas. MEC2 is a specific marker for Ewing sarcoma. Ewing sarcoma is most common in second decade. And what else we get? Onion peel appearance. Joint spared in osteoarthritis is metacarpophalangeal joint and wrist joint. In rheumatoid arthritis, it is DIP. Heberden nodes and Bouchard's nodes are seen in osteoarthritis. B comes first, so it involves proximal interphalangeal joint. H comes later, so it involves DIP. Heberden nodes are seen in DIP and Bouchard's nodes are seen in PIP. HLA-B27 positive diseases are Pierce. Pierce stand for psoriatic arthritis. Psoriatic arthritis. What are the criteria for the joint involvement in psoriatic arthritis? Casper criteria. Antropathic arthritis, ankylosing spondylitis, reactive arthritis. So these all diseases are positive for HLA-B27. Sappho syndrome. What does Sappho syndrome stands for? S for synovitis, A for acne, P for pustulosis, H for hyperosteosis. In pseudo gout, fluid analysis reveals calcium pyrophosphate. Gansilin test is for SI joint. Part of spine involved in RA is cervical joint. Pseudo fracture is also known as milkman's fracture. or loser's zone. It is seen in osteomalacia, hyperparathyroidism, and it involves neck of femur, ribs, and pubis. Champagne glass pelvis is seen in achondroplasia. Mutation seen in achondroplasia is FGF3 mutation. Also, you see trident hand and rhizomelic phenomenon, which means shortening of proximal limbs. Shortening of proximal limbs. Bone within bone appearance is seen in osteoporosis. Ivory vertebrae are seen in Paget's disease. Antibodies to rankle are seen in drug is denosumab. It is used in osteoporosis. What kind of vertebrae we get in osteoporosis? Fish mouth shaped vertebra. The vertebrae are concave in osteoporosis. Ape thumb deformity is due to medial nerve injury. Medial nerve injury. Why? Because there is injury to abductor pollicis muscle. Cock-up splint is used for radial nerve injury. Knuckle bender splint is used for median and ulnar nerve injury. So how to remember this? See friends, you have to remember the action of the muscle. Median ulnar nerve supplies lumbricals. Lumbricals cause flexion at metacarpophalangeal joint. So for the injury of ulnar nerve, we will need a splint that will cause bending at the metacarpophalangeal joint. Radial nerve causes extension of MCP. So we need a splint that causes extension at metacarpophalangeal joint. Froment sign is for ulnar nerve injury. Ulnar nerve. Erb's paralysis deformity is mnemonic is Fabers is lost. Fabers is lost. Fabers is lost. So patient is unable to do flexion, not able to do abduction of shoulder, external rotation, and supination. So the arm is extended, adducted, internally rotated, and pronated. So this is the position of the arm: external rotation, adducted, internal rotated, and pronated. So the mnemonic is fibers is lost. What is myalgia paresthetica? It is damage to lateral tenuous nerve of thigh. Chiralgia paresthetica is involvement of superficial radial nerve. So what is this? Rugged jersey spine. It is seen in hyperparathyroidism. Hyperparathyroidism. What is this? Bone within a bone appearance. Osteopetrosis. What is this? Cotton wool spots. These are seen in Paget's disease. What is this? Cupping, fraying, and splaying of wrist. Seen in rickets. What is this? Posterior medial defect in tibia. Posterior medial defect in tibia. It is seen in Blount's disease. Alpha angle in DDH decreases. So this was about ortho revision. You will see some more revision sessions about ortho. Thank you friends, and do like my video and subscribe my channel.